Well, there are nutrition and lifestyle strategies that can be employed to reduce colorectal cancer risk. So let's talk about fiber. That is something that we really love to believe could play a major role. So this was a very large study of over 60,000 women from the Swedish mammography cohort that completed a food frequency diary, and they were followed for a long time, 14.8 years. And this showed that a high consumption of whole grains was associated with a lower risk, 35% lower risk of colon cancer, but not of rectal cancer. What it basically required, however, was greater than 4.5 servings per day versus what typically can be found in an American diet, which is less than 1.5 servings per day. The problem is that as many studies as there are showing efficacy of fiber, there are that many which really show no significant effect. So another very large study of comparing over 80,000 female subjects to 47,000 female subjects from the Nurses' Health Study showed also here that there was no significant association between the intake of fruits and vegetables and colorectal cancer incidence. The reasons for this disparity is really unclear, but it probably is that fiber has to truly be taken over one's lifetime and not something that merely can be added to the diet over a short period of time to have any significant effect in the development of colon cancer. Now, calcium is another thing where there is a great amount of controversy over, but overall studies really have been very inconsistent in showing a benefit. And although there's been some minor benefit seen, usually it's statistically not significant. These are the studies themselves. One was using calcium supplements for the prevention of colorectal adenomas. This was in nearly 1,000 patients using 1,200 milligrams a day. This was associated with a decreased risk at about 25%. Another study, also from the Nurses' Health Study, showed a 27% reduction in the risk of colon cancer. But as I said, there were 3 inconsistent studies as well. One was showing calcium and vitamin D. This was in New England Journal of Medicine. Another in the American Journal of Epidemiology, also with calcium and vitamin D, showing non-statistically significant results. And lastly, another one trying to look at large bowel polyps. So basically, there's really no significantly strong evidence supporting calcium. Vitamin D, on the other hand, really now is a major player in carcinogenesis, not just in colon cancer, but in many cancers. And at this point in time, internists are really rapidly checking vitamin D levels in most patients because many Americans really related to the fact that we've drilled into patients that they should not be in the sun and that we should be using sunscreen. That's the main reason why a significant proportion of Americans are actually vitamin D deficient. There is strong evidence to support anti-colorectal cancer effects of vitamin D. The best sources are certainly sunlight, so just even obtaining 15 minutes a day of sunlight could actually help. But because we ask people to avoid excessive sunlight exposure, people could supplement with fatty saltwater fish such as tuna, halibut, mackerel, herring, sardines, and also vitamin D fortified milk, and there are many enriched breakfast cereals that have vitamin D. The dosage would typically be for someone who's 19 to 15 years of age, 200 international units a day, and as people get older, it's higher dosage, 400 for patients 51 to 70, and over the age of 70, 600 international units a day. There are studies to support vitamin D. This was looking just at a large meta-analysis of 5 epidemiological studies that found a 51% decrease in the risk of colorectal cancer in patients who had high plasma levels of vitamin D. And colorectal cancer patients, and this is very interesting, but colorectal cancer patients that had a high pre-diagnosis of plasma vitamin D levels actually showed a significant improvement in overall survival in comparisons to patients who did not have a high pre-vitamin D level prior to diagnosis. So that's a very interesting study to show the beneficial effects of vitamin D supplementation. What about multivitamin use and folate acid in colorectal cancer. This was another 15 years of multivitamins. Just folic acid itself led to a reduction in colorectal cancer of 75%. Folic acid can be found in dark green leafy vegetables such as kale, spinach, romaine lettuce, asparagus, and broccoli. And if one were to take a multivitamin, that would be using 400 micrograms of folic acid. So certainly that seems to play a beneficial role, and especially in women who are at the age to be able to conceive. We like to have them on folic acid anyway to avoid neural tube defects. So certainly I would recommend to a woman at childbearing age to go on that, but that actually may play a significant role in hampering the development of colon cancer itself. There have been many studies about hormone replacement therapy. The largest trial was the Women's Health Initiative that looked at use of estrogen and progesterone in over 16,000 postmenopausal women. Now, this unfortunately identified more overall health risks instead of benefits. So hormone replacement therapy, although it was associated with a significantly decreased risk of colorectal cancer development, there was a greater risk of lymph node involvement and more advanced stage of patients in breast cancer if they were on hormone replacement therapy. So at this point in time, we cannot advocate using hormone replacement therapy as a prevention for colorectal cancer. Smoking itself just does nothing good for any cancers. There's enormous evidence to show that it can affect anywhere in the aerodigestive tract the increased development of colon cancer. That includes esophageal cancer and gastric cancer, colon cancer. So just there is no reason to smoke, and certainly in terms of if you were trying to decrease one's risk of developing cancer, so the best thing you can do is to lose the smoking habit. What about red meat? Eating a lot of red meat is definitely considered a risk factor for colorectal cancer development. Even changing to leaner cuts of beef can make a difference. So if one really enjoyed eating meat, just by changing to things that might be a leaner cut of beef or pork or veal, that could even make a difference in your risk. But certainly if you're going to eat meat, the thing that you really have to be careful about is blackening it, charring it, and cooking it well done, because there is a definite risk between heterocyclic amines that form when meat is cooked at very high temperatures that leads to an increased risk for cancer development. So if it was summertime and one is barbecuing, just trying to move that meat at least off the direct fire, even just doing that can make a difference in the risk factor related to red meat. This is just some data to support some of these things, and this compared meat and fish consumption in patients with colorectal cancer. This prospectively followed almost 500,000 men and women who were cancer-free at baseline, and at 4.8 years, over 1,300 patients, there was an incidence of 1,300 colorectal cancers identified. And in this study, they looked at the consumption of red and processed meat, fish, and chicken, and they adjusted it for age, sex, fat intake, smoking, and also fiber. And there was a positive association with red and processed meat. Certainly the highest were patients that consume more than 60 grams a day versus less than 20 grams a day. There was a 31% increased risk in those patients. So let's just talk about how much is in a gram. When we're talking about 1 ounce of this meat, and that is pre-cooked 1 ounce, that is 28 grams. So you can see that's not a lot of meat that we're talking about when you think about how big a portion is. And I didn't even talk about portion size in the United States, but when we think about the portion size, that really gives you a major sense of how increased the risk can be with, let's say, an average size hamburger patty at a fast food restaurant. There also was, interestingly, an inverse association with fish intake and no association with poultry. So if one wanted to think about healthy choices in protein, I would definitely try to take fish and chicken as choices over meat products.